Africa is a continent rich with opportunity. And when business and communities come together, its astonishing potential begins to be felt. With the Sustainable Development Goals steering these partnerships, Africa's future is being rewritten with innovation, foresight, and inclusivity. Crossing the length and breadth of the continent, our journalists uncover these stories and share them with the world. Join us now for remarkable stories of partnerships across Africa, building the future and changing lives. It's Africa's time.
In Africa, a lack of access to quality healthcare is a huge barrier to growth. Governments are overstretched and are turning to the private sector for help. In this episode, we'll visit Nigeria and then Kenya to explore these partnerships. First to Nigeria's Obafemi Awolowo Teaching Hospital in Ile-Ife, where a global healthcare company is supporting a successful early detection and cancer treatment project known as GIPAP. It offers medication, state-of-the-art treatment, and wonderful opportunities for young medical professionals to advance their craft and save lives.
Now, the GIPAP program is GLIVEC International Patient Assistance Program. It's a program that makes it possible for patients to access this medication absolutely free. Hematology is just that building, the red roof. You notice that most of the roofs here are sort of new.
Oh,
these
yes,
are the new,
exactly.
These are the new portions of the hospital.
I see.
And then on this side, there are the older portions.
Novartis Healthcare is the private sector partner on the project. It's been working closely with the university's hematology department since 2003 and is helping GIPAP reach well beyond Ile-Ife.
What we have is an arrangement whereby patients come in mostly for chronic myeloid leukemia, commonly called CML, and gastrointestinal stromal tumor, commonly called GIST.
If you come down with metastasis or very advanced GIST, in 6 months' time, we are gone. Because unlike CML, the GIST is unresponsive to most chemotherapeutic agents, even radiotherapy. And stem cell transplantation will not do the trick.
So patients with these two conditions, they come into the hematology daycare, we see them, we request some investigations. When these investigations fits into the profile that GIPAP would like, these patients are then registered onto the GIPAP program.
It's a targeted medication because you need to have the marker. So we now have a situation where we have patients with advanced GIST still alive 10 years after starting the new medication.
Many of our CML patients with chronic myeloid leukemia, had like 2 to 3 years survival at most. And most of these 2 to 3 years, they are in and out of the hospital, they are generally very ill. But with the advent of the GIPAP program, what we have seen is that patients with CML practically feel like they are not ill at all. We have a drug that is orally administered. Patients can take it at home. It's not by infusion. And the moment they start this drug, it's almost magical. Within 2-3 months, they begin to feel very well. And most of them can return to their places of work and begin to live their normal lives.
We now saw patients who came with Philadelphia chromosome positivity of over 60%, going down to 0. That was very exciting.
But the impact of GIPAP is on more than just the patients. Adiola Adeniyi is a 30-something medical professional, and the program is allowing her to practice the kind of medicine that she's dreamed of since childhood.
One of the happiest days of my life was the day I graduated from medical school. I called my parents and my siblings. I started telling them, I'm a doctor. I started telling everyone. Everyone was happy for me. I decided to specialize in hematology during my internship. I wanted to go into diagnostic medicine, and also I still wanted to attend to patients. I want the clinical part of it. and it's only hematology that has both.
So Adeniyi, at what point in the GPAP program do you go to the lab, and what do you do with the results that you find?
When the patient first comes, we do the test to confirm the diagnosis, whether the patient is actually having leukemia, CML to be specific.
Yes.
Then, after we have diagnosed and the patient has started the drug, we also do the test to see if the patient is doing well on the drug. I chose OAU, Obafemi Awolowo University Teaching Hospital for my residency program because it's one of the centers in the country that offers the best training in hematology. Since the commencement of the GPAP program, it attracts patients from all over the country, and at times we may have as much as 100 patients on a clinic day. How is the patient result?
2%.
Okay.
So he's doing well, that's what that means.
Yeah, it is.
The department has been lucky to attract high-quality residents, very eager, really, to learn. For instance, for hematology, the minimum duration of training is about 4.5 to 5 years in Nigeria. In fact, many times it appears as though there's not enough time for them to learn all that is required of them.
When I get to work, I'll go and see my patients, ask them if they have any complaints, how they've spent the night, if there's any problem. And then after that, I'm going to collect their sample to run their blood test. I usually do that twice a week to see the level of their blood, how they've been responding to the treatment that we're giving them. During that process, any of my senior colleagues may call. They will also come and join me on the ward to see the patient together. After I'm done with that, I try and study as much as I can. I have another home in Osogbo where my family is, but this place is very close to the hospital. And my flatmate, she's a nurse, and she's been wonderful. Alpha, what did you cook now?
I'm going to make.
Your resident doctors are happier that what you've been dreaming of, they only read in books, is now in practice. They can see it, they can feel it. The patient themselves can say, something is happening to me.
In Nigeria, a pack of the drug, for a month's drug, costs about 600,000 naira. Where are they going to get that kind of money? But the GPAP program has subsidized this for them. They're not even paying for the drug. It makes it available for them free of charge. And it's actually helping them. GPAP is an amalgam of, there's Novartis on the one arm, there's Axios, there's the Max Foundation. These three organizations, private in their own right, came together to provide this access program.
And Novartis, as a private sector company, we take our role very, very seriously. However, we know that we cannot do everything alone. We need partnerships from governments, from NGOs, from hospitals, from hospital groups. We really want to work with the healthcare professionals. We want to work with the pharmacists. We want to work with everybody who's a provider in healthcare to streamline the distribution of medicines and create proper access.
Public-private partnerships have really been able to catalyze transformation by giving people access to healthcare that wasn't available to them before. So not only does this mean that the death rate is lowered, but it also changes people's perceptions around chronic illness and disease, making them feel that it's not a death sentence and they actually have hope for a better life.
It has really brought back if you can say, the humanity in some of these patients. They can go back to their places of work, they can be part of their family, they can enjoy their free time. And we have seen, for instance, 1 year survival is about 95–96%, 2 years is about 90%, 5 year survival is about 75–78%.
When somebody heard that I have a cancer, they think the end has come. Now we counsel our patients and tell them that having CML is just like having an hypertension or having diabetes, that you just have to take your drugs for life. And that's what GPAP has made for our patients. It has revolutionized the treatment of CML in this country.
It's Africa's time.
We've just been in Nigeria exploring the impact of public-private partnerships on access to healthcare and how a unique program called GIPAP, funded by Novartis, is saving the lives of so many cancer patients through screening, treatment and medication. Now we're flying to Nairobi, Kenya to see how the program is faring there. Former banker Ferdinand Mwangura is a cancer survivor with a big story to tell. A beneficiary of the program, he's now become a patient activist, supporting others and lobbying for access to quality healthcare for all.
It started with very severe symptoms. I had lost a lot of weight and my skin color had completely changed. I had a very sharp pain in my abdomen, and this prompted me to look for a doctor. I was diagnosed with chronic myeloid leukemia, a form of blood cancer. Yep.
When you were working as a banker, did you ever imagine that you would end up spending most of your life's work in a hospital?
I never thought I would even be visiting a hospital that often, but life has its own ways of changing, and I appreciate everything that has happened so far.
The GIPAP program has been housed at the Nairobi hospital, and the hospital has the required diagnostics and lab tests which are very essential for the well-being and monitoring of the patients. Also the oncologists and other physicians who support these patients and give their consultation free of charge.
My story about surviving cancer has been full of joy and some very tough moments. I cannot underestimate the importance of family. Family is key. Family is stability, family is continuity. So they are very important to make me stay afloat. However, I am cautious that every bit of my life has to be approached with a certain measure, because I'm cognizant to the fact that I'm a patient.
Currently, we have about 663 patients in the program, and this program has been running in the country for the past 12 years. There are patients who were first enrolled in the program 2004, and they are still living and continue with the productive life.
I started advocacy immediately after diagnosis, and I realized that was more or less like a calling, my path towards life.
Ferdinand is the current chair of the group called HENZO, a group that was formed by the patients in the GIPAP program. So he does the coordination of the activities of the patients.
Having been through the program himself, Ferdinand is a source of inspiration, comfort and information to other GIPAP patients who come to the hospital twice a month on clinic days. He's a passionate educator, helping fellow chronic myeloid leukemia patients stay positive and function optimally while on their meds.
I put a lot of emphasis on psychosocial support. It equips the patient with the right tools to survive. And this psychosocial support is also extended to the patient's families.
He also travels around the world, picks up information. He also organizes meetings with us where we give talks to the patients, explain to them their diseases, explain to them their symptoms, the side effects of the medicines, what to expect.
Treatment is definitely holistic. Treatment does not involve just taking your medication. First and foremost, you need to ensure that you're eating well, your diet. Second, you have to be active. Psychologically, you need to be at peace with yourself.
What I admire about Ferdinand is that he's made himself a valuable resource to both patients and to healthcare professionals. For patients, they can access him for emotional and psychosocial support because he's walking the journey of surviving cancer. And healthcare professionals can use him to disseminate important information to patients in a way that is personable and understandable, therefore empowering patients and helping them to take ownership of their own lives.
As a force, when they are together and there is a challenge, then they approach this as a group And it's better to have a group speaking with one voice through one representative.
I live to make an impact, and that is what gives me the energy to wake up every day. And it is very satisfying. It is very fulfilling.
Public-private partnerships are not only helping with access to healthcare in urban spaces, but in rural areas as well. We're off to the Familia Nawiri Community Screening and Education Program, also funded by Novartis, in Kirinyaga County, Kenya, where mobile clinics offer early detection and treatment for non-communicable diseases. A passionate call by community health facilitators reminds locals that the clinic has come to town.
Mimi nilikuwa nikitoka huko kwa samba kuendea ng'ombe, halafu nikasikia nikiwa huko kuna wandaktari wanakuja na wanaangalia watu msuri, nikatamani kukuja.
What happens at the health camp, actually, I like calling it a mini hospital, because what we have done, we have each and every service area, where we start with the waiting area, and then from there we have people getting registered. They pay a nominal fee of about Kenya shillings 200. Here, once they pay the amount, that's it.
Yes.
They get everything else done for them.
Yes.
Yeah.
And does it always happen just at this primary school?
No, it doesn't. We move around the locations. We have where we have the community health facilitators. They work in different locations. So today we are here. Next month we are going to be somewhere else.
Okay.
To give a chance to almost everybody within our working area. Yes, and it's important because we know even at the fee we are asking them of 200 shillings, it's very minimal as compared to the kind of services they are going to get. Yeah. We target the rural areas because this is where people walk for long distances to get the nearest facilities, and the health facilities they have, some of them lack the amenities.
Kwa sababu nilisikia wakisema mambo mazuri sana, kwa maana tunakuanga na sinda ya mwili. Unaenda hospitali, unaandikiwa dawa, unakuja unakunywa, halafu hiyo kitu inarudi tena. Nao walikuwa wanasema ati watatengeneza watu mzuri. Daktari amenisaidia sana kwa sababu hata nilikuwa nimesahau pale pengine wakinisumbua na daktari akaniuliza. Si unaona kama hakuniuliza singesema.
People who are of reproductive age, that's in female, they get to be checked for breast examination, and we also do cervical screening for them. Anyone who wants family planning also gets to have that done. Where the men are concerned, we actually do the prostate cancer check because, again, cancer is also now becoming another killer disease within our country.
Over the last so many years, diseases like tuberculosis, HIV, AIDS, malaria have been on the decline thanks to the tremendous effort made by all of the stakeholders in the healthcare industry. What we are seeing in Africa now is a rise in the non-communicable diseases. So diseases like hypertension, diabetes, overall cardiovascular diseases, as well as cancers are on the rise.
The Kenyan scenario of diabetes is quite alarming because we're seeing increasing cases of diabetes all across the board, but we're seeing more and more gestational diabetes cases. We're also getting more cases of childhood diabetes, type 2 diabetes, and polycystic ovaries and insulin resistance.
Disease has a major major impact on development in as far as it compromises the ability of the country to produce goods and services for consumption.
So we really need to go back to basics if we are to salvage our country and our continent, because the diabetes and non-communicable diseases are just on the rise. There's something that's going wrong with the whole lifestyle.
One would want to see a culture of health-seeking behavior and a culture of provision of services that are of good quality, that will reach out to a lot of people, and that will take cultural considerations in place.
Familia Nawiri is actually a Novartis social venture. It's a way of them bringing affordable, quality, accessible medication to the people in the rural setup in the countries that they operate in, because they're not just in Kenya, but they're in other countries as well.
If we can go to the communities out there and really give them the information that they need at grassroots level and encourage them about healthy eating habits, encourage them to go for screening, we can empower and educate the patients so they get control of their condition.
All of us would want to live a longer life, but how do we do that? We can only do that by knowing what it is that we have. Sometimes some of these things are reversible if they are detected early. And with proper medication, proper treatment, that can be preventable. So we encourage people actually to ensure they go for screening.
Nilisikia wakisema wako na mashini nzuri ya kuangalia watu wagonjwa na mambo mengi.
We have different tests that we run. We have malaria, we do typhoid, and we also do rheumatoid factor for the arthritis. Once they're done with the lab, they go back to the clinician for the medication to be prescribed, and from there they go to pharmacy.
Sasa vile mimi nimeona kweli nitasaidika. Kwa sababu sikuwa nafikiria hivyo. Nimeona kweli nitatengenezwa na nitafaidika.
Familia Nawiri health facilitators like Consulata also do outreach, visiting communities and local chiefs to share health information and to inform them about upcoming health camps in their area.
Once in a while, we do home visit and we inquire on when was the last time they were dewormed in that homestead. Do they use mosquito net? And then do they have clean water? If we don't, we advise them the need of treating their water. We look the compound how it is. Is it clean? If it is not, it's our mandate to tell them what they are supposed to do, and then supervise the toilet, whether it is deep. And we tell them when it is a quarter to be full, they should dig another one. And then after that, we also look for whether they have somewhere to put their rubbish. And then after that, we visit the bathrooms. If they are not clean, we advise them on how to do it. And then we go on and ask them whether they have soap in the bathroom, how many people use these bathrooms, and then whether they share the towels. Because you find them in some homestead, they use one.
The dream is that every African patient who needs medicine gets access to that medicine. That is not inconceivable. If the private sector, companies like Novartis, are able to partner with governments, are able to partner with NGOs, and everybody really works towards this common goal, I think creating a universal healthcare in Africa where patients can get access to life-saving medicines is not a distant dream. And Novartis is right here in Africa wanting to make those investments and grow with Africa.
My dream of my bucket wish is to ensure that we get to see more and more people. And in the process, we can be able to do even more services than what we are currently doing. I'd like to see us doing something like dental. I'd like us to do something like optical, to be able to give a one-stop shop to the people who come to the health camp. That is what I'd love to do. I'd love to see that.